Okay, these last 3 points that I want to talk about on the small intestine channel, small intestine 13, 14, and 15, these are some incredibly important points that I do extremely commonly in my practice. I found that most patients hold a lot of work stress, life stress, emotional tension, um, the way people sometimes unconsciously deal with the uncertainty of the future, uh, or the tremendous amount of obligations that they have to deal with, or confusing situations, or situations that are fast changing. These are phenomenal points to do for the embodied tension and stress that people hold for all of these various emotional issues and psychological issues. So small intestine 13 is crooked wall or bend wall. 14, outer shoulder shuo, and 15, central shoulder shuo. These are found just lateral to the level of T2 in the transverse process, and that's going to be just inside, just actually lateral to the medial edge of the scapula. You'll feel a depression here. There's an indentation in this area here that goes in at the top portion of the scapula. And then at about the level of T1, roughly 3 sun lateral to the governor vessel, roughly level with T1, you'll find small intestine 14. That's kind of about where the first rib meets the level of the clavicle, although it's hard to feel the clavicle for most folks because it's very deep under the muscle layer. And then you've got small intestine 15, which is roughly 1.5 sun or halfway between the medial edge of the scapula and the governor vessel line, found in the muscle right at about the level of the spinous process of C7. And again, like all the points between small intestine 9 and small intestine 15, these are largely decided upon either by the issue that relates to the patient based on maybe something about the name, or most especially upon palpation. So that's one of the main ways I differentiate in terms of how I want to treat, or by virtue of the functions afforded by the muscles in the area. So, these are not so much about our capacity to extend, but more like to hold our head up and also to keep our shoulders relaxed. So in the face of a lot of stress, a lot of tension, the shoulder starts to come up, right? The neck starts to tense. Oftentimes the head will start to go down under the weight of all of our obligations, under the weight of all of the stimulus that we have to sort through, right? So these are phenomenal points to release a lot of the stuck chi and blood that's causing tension, stiffness, pain, and frankly, a lot of times our patients aren't really even consciously aware of how they're holding their stress until it reaches such a point where it then is causing pain. So these are 3 points that I will often do in combination, often with E-stim as well as the other ones. And I'll often do these 3 together, usually starting actually with 15, even though numerically the channel works this way, from the extremities to the head to 19. Generally, I'll put 15 in first, then 14, then 13. And again, like the other points, these are phenomenal points to place moxa on the needle, to bring the heat through the metal of the needle, down into the deeper levels of the tissue, down into the levels of the fascia, or even the muscle layer. And another way is to certainly do the circular needling technique, which you'll learn in 7th trimester, to dispel any kind of wind, right? So the moxa helps to dispel cold and warm the channels and warm the muscles. This needling technique helps to dispel chi, helps the body to pull that chi out, or to remove the chi. As well as simply with E-stim, very gentle E-stim. Now, if you don't want to do any of those things, you can just simply needle these points. By going in generally perpendicularly. I often don't sedate in terms of moving or angling the needle towards the preceding point. Actually, I found just going in perpendicularly to where the level I feel the ashi tension. So when I'm palpating these points, not too hard, because I want to be able to tune into the subtleties of what's going on underneath the tissue. So it's a balance between pressing hard enough to feel where the muscle knots are, because that's actually, with these 3 points, that's what shows up the most, is muscle knots along the traps or inside the deeper rhomboid muscles underneath of the trapezius. But to palpate along here, to feel about how deep do I feel that muscle knot, and that's about how deeply I want to needle. I want to very slowly insert the needle in all of these points to where I feel the muscle knot, where I feel that tension, where I feel that resistance, and just stop there and just very gently, maybe just peck a little bit, or you can do some gentle lifting and thrusting, right, to release the tension of the muscle fibers and the fascia being held tightly together. And again, that's our natural response to wind and cold. The body tries to armor itself and protect itself by being tense, right? Which sort of like seals off the area. When we tense up, right, we're like bracing ourselves physically, psychologically. So if someone is kind of stuck in that coping mechanism loop, if they're stuck in that reactive loop, they don't know how to untense again. So they just kind of stay stuck in that posture. So one of the postures you'll see is like a forward head or a raised shoulder, right? Maybe even curled forward a little bit. And these points are often done in conjunction with points on the front. I didn't mention earlier, but near the point of small intestine 11, right? Superior medial and inferior lateral, right about here and here, you have 2 other additional motor points for the supraspinatus muscle, the infraspinatus muscle. Small intestine 12 and the area around small intestine 12 is actually the motor point for the supraspinatus muscle. And these are said to have a powerful effect on the motor nerve, affecting the levator scapula muscles. So the levator scapula muscles, it's actually a group of muscles that come down, that go from these 3 bones here and attach in different areas along here. So C7 attaches down here, T1 attaches sort of in the middle, and then T2 attaches right up here. So they go through roughly all 3 of these points, and the levator scapula muscles, or muscle itself, it's a group of muscles and muscle bands. But these are one of the primary muscles involved with holding the body tense and responding to tension. A lot of people think it's the trapezius muscle, and oftentimes the trapezius muscle is involved. But more often than not, I found it's the deeper levator scapula muscles that are the ones that are truly most affected by psychological stress, emotional stress, and how we hold that in the body in a way to kind of armor ourselves from anything else getting in, right? We don't want to be invaded. That's enough. That's what Taiyang does. It keeps things at the exterior. And that's our most superficial level of the 6 divisions, especially anyone studying Shangheng Lung and the herbal tradition. But we know that that's actually the outermost yang layer of the body, that zone, that Taiyang zone. So these are 3 points that are fantastic to do, especially deeper into the muscle where you feel that ashi knot, to treat all 3 of these together to really open up the whole upper back, to relax the neck. And again, these muscles eventually track into the skull. So this is really good for manifestations of occipital headache or sudden stiffness and pain that like radiates up, or sometimes starts in the head and radiates down. So these are great points to include for anybody who's stressed out and really tense.